Hello everybody, I am Dr. Puneet CS working as neurologist at Sri Gokulam Hospital, Salem. Today I will be talking on epilepsy. So what is epilepsy? Epilepsy is nothing but increased electrical activity in the brain causing an abnormal movement of the limbs or unconsciousness. So how do you recognize this epilepsy? This can be in the form of sudden onset unconsciousness, jerking of the limbs, jerking of the eyes, flickering of the eyes, sudden flashes of light in the eyes, sudden abnormal movements of the abdomen, and many a times sudden staring. Just patient will be having a vacant stare look, that is called as absence epilepsy. So epilepsy is generally classified into a generalized epilepsy or partial epilepsy. So generalized epilepsy is patient will have movements or jerking of the limbs of whole body, and patient will have loss of consciousness. So patient will have loss of consciousness and jerking of their body. Whereas partial epilepsy, only particular part of the body is having jerking, like for example only upper limb or only lower limb or angle of the face or angle of the eye movement. So how do you recognize this epilepsy? So in many a times what happens is, in the peripheries they always think that epilepsy is a disorder wherein a ghost has gone into the body of the person and all. So that lot of myths are there. So it is very important to recognize this symptom, and we should immediately take the patient to the nearby hospital. So what are the first aid whenever you come across with epilepsy? So any patient who comes or experience an epilepsy, make sure that he is far from all the sharp objects, or like for example a cot, railings of the cot or any sharp metal, so that he will not injure. Then the other thing is, patient should be put on lateral position. It can be in the form of right lateral position or left lateral position, so that he will not aspirate. So many times what happens is, when there is epilepsy, there is increased secretion, so that there is high chance that patient will have aspiration. So to prevent that, you have to put him on one position, lateral position. So the other thing we can do is, you can put one kerchief in between the teeth, so that you will prevent tongue bite. So tongue bite is one of the manifestation of epilepsy, wherein patient can have injury to the tongue and as well as bleeding. So these are the first aid. So immediately what you do is, after doing this, immediately bring the patient to the hospital. So in the hospital, what we give is, to decrease the electrical activity, we have certain medications. So we give initially IV drugs, whereas injections, in the form of injection, it can be in the IV or IM form. Then we give tablet form. So then we evaluate with imaging. It can be in the form of MRI or CT scan. Subsequently, we also do investigation known as EEG, wherein we place electrodes over the scalp and then detect which part of the brain is activated, and accordingly we will treat. Certain in epileptic syndrome will not get controlled with one drug. So in those cases, we have to give 2 to 3 drugs. Sometimes with many drugs also, patient will not have improvement with seizure activity. So at that time, we give advanced medication, along with that some diet modification and also some surgical treatment. So only in resistant cases we opt for surgery in epilepsy patients. So this is about epilepsy. So whenever you recognize this symptom in the form of jerking of limbs or vacant stare, sudden unconsciousness, immediately bring patient to the hospital, so that proper care can be given. So thank you.